All right. Thank you so much, Ikaika. We are all honored to just hear you play for us in our entry. So welcome. Welcome everyone to Hawaii Care Choices Healthcare Talk Story. I'm Tish Fukushima, your moderator this morning. Presenting today, we have Lani Weigert, Community Relations Manager, and we also have two special guests, Dan Brinkman and Ikaika Marzo, joining us today. But before I start, I want to ask the audience, for those of you on Zoom, if you can hear me and see the PowerPoint that's on the screen, please give me a thumbs up. We also have those joining us on Facebook Live. I want to say aloha. Click like or send a comment in the comment box below. If you like, we want to hear from you too. All right, I got some thumbs up from our Zoom attendees. Aloha, welcome. We want to let everyone know that today's meeting is being recorded so that you and others may access it in the future. To our Zoom participants, if you have any questions at any time, you may use the chat feature. You can also utilize the Q&A box at the bottom of your screen. For those of you on Facebook, please use, again, the like button or the comment box. We're happy you can join us. We are doing polls today. Unfortunately, Facebook Live does not have the ability to engage in polls. If you would like to join the fully engaged Zoom presentation next month, please email me at lfukushima@hawaiicarechoices.org. So the polling is very simple for all our Zoom participants. There's no right or wrong answers, and this is how it's going to work. A question will pop up on your screen. Please make the selection you think is best and press submit. To kick things off, we are going to get you very comfortable with Icebreaker. So that will be coming up on your screen. The Icebreaker question is, if you could have a superpower, what would it be? Would you read minds? Would you become invisible? Or would you want to be able to fly? So go ahead and plug your answers in. Just to get you all comfortable, make sure the blood is flowing, that we got coffee going or water. All right, we got a bunch of them coming in. It's kind of a hard pick. I would choose between flying or invisible for sure. So to choose one is really hard. Okay, so I am going to end it there and we will be sharing your results. 13% of you said you would read minds, 25% would become invisible, but 63% would be able to fly. Awesome. Okay, well, that is how easy the polling is. So I just want to let everyone know that those will be coming up throughout the presentation at any time. I would like to introduce to you to our guest speakers. We have Lani Weigert, who's the Community Relations Manager for Hawai'i Care Choices. Aloha, Lani. We have Ikaika Marzo, business owner, community leader, and hospice advocate, also 2020 mayoral candidate. Aloha, Ikaika.
Aloha.
We also have Dan Brinkman, East Hawaii Regional CEO, including Hilo Medical Center, and HHSC Corporate Board Member. Aloha, Dan.
Aloha.
Thank you all so much for joining today. We're going to kick things off this morning with Ikaika Marzo, who is an energetic business leader running for mayor of Hawaii County. Mr. Marzo united the community during 2018 Kilauea eruption, spearheading the Pu'uhonua Opuna Relief Center, also known as the Hub, to provide essential resources and information to displaced victims with solid aloha. He has since continued to engage and represent the island's communities, first during the eruption recovery phase, and now through the pandemic disaster. For his services in the Hawaii Island community, Mr. Marzo received honors from the State of Hawaii House of Representatives, Pacific Risk Management Ohana, T. George and S. Paris Foundation, and was awarded Best of East Hawaii Community Leader in 2019 and 2020. And for those that joined us a few minutes before we started, he is also a wonderful slack key guitar player. Aloha, Kaika. Can you start by telling us why you are a hospice advocate, and if you had any friends or family in hospice, and how that experience was for you?
So, you know, my experience was in, I think it was 2015. My grandfather went into the hospital for an injury on his leg. He was healthy. He was at 76 years old. He went into the hospital, and in about a week, his health deteriorated. He had infection and pneumonia. And then in about a week and a half, couple days before, his future was grim. We didn't see, well, the doctors didn't see him overcoming what was happening. So he wanted to go home. That's where he wanted to pass. And hospice made it happen. Wasn't for hospice, you wouldn't have a chance to get home. So we worked with hospice. Our family worked with hospice. They made it happen within hours of his passing. Coordinated the whole process of transporting him from Hilo Medical Center to Kalapana. And that was his number one wish. And hospice came through, and you know, it was so awesome to follow the ambulance back home, and we took him out of the ambulance. He was smiling, and he was talking, and once he reached into the house, 10 minutes after that he reached into the house, he passed. And we knew he was happy because that's where he wanted to be. And if it wasn't for hospice to help us get us through that process, you know, we wouldn't he wouldn't have what he wanted. And you know, we talk about how awesome hospice was during that time. And so that's one of the experiences. And my other one was with my mother-in-law. My mother-in-law had passed over cancer, and you know, and my other half, my girlfriend for 10 years, she lives in New Mexico. And my mother-in-law was fighting cancer for 3 to 4 years, and she had a rare cancer that was attacking all of her organs. At the end of her life, you know, we just wanted to mahalo hospice for being there at the end of her life. But you know, we should have, ask for help a lot sooner. And sometimes our family members that is going through the process, and our family members that are, they don't have that much time in their life, and when they see hospice, they feel like it's the end, but it's not. It's not the end. It's helping our families go through the process. And at the end, hospice came in and helped my family in New Mexico to go through the process. So much aloha to the hospice ohana, because I think there's many great stories out there, and that's my great stories that I have of hospice, my grandfather and my mother-in-law. So you know and I'm sure I'll have a lot more stories in the future. But and I'm sure that there's a lot of people appreciate hospice within our community. So that's my story.
Thank
Kind
you.
of it was a little take me back, and for me it's just there's a soft spot in my heart for hospice because of what they have done for my family during the hard times. Mahalo.
Thank you so much for sharing that, Ikaika, and we appreciate your vulnerability for sharing your story as well. And can you tell us briefly, share your background and what you're doing now?
So I'm right now I'm running for Hawaii County Mayor. I'm a business owner. I've been a business owner for over 10 years, and my business was impacted during COVID-19 because of my business was surrounded around tourism. So I developed a business where there was no economy in a community. So Kalapana, I developed a company called Kalapana Culture Tours, and what we did was empower our own local families, friends, extended families, extended friends, and create quality jobs within a district that there was no jobs. Our families were driving not only to Hilo, but that's a 45-minute drive from Kalapana to Hilo, but also across the island to Kona for jobs. And we would notice that the quality time with our families, like quality time between parents and keiki, was minimal. There was none because the traveling time was 5 hours. They would work 8 hours, 10 hours. So that's 15 hours on the road or away from their kids. So we want to create a business where they could stay home, work in their community, come back home and spend quality time. So we became a real successful business. It was named 2 years in a row East Hawaii Best Company in the Trip and Herald. And then not only that, but also in 2018, I coordinated one of the most strategic groups and hubs in the history of any eruption in Puna. And I coordinated the Pu'uhonua Puna, or also known as the hub, where we was a crucial component within the community to bring not only donations, but goods. And, we would feed people 3 to 4 times a day, thousands of people every day, and coordinated crucial information for our community during that time of the eruption. And now we move forward to COVID-19. So now we're into another disaster mode, bringing awareness and information to our community. So, and now I'm running for mayor. So, we're less than a month away. So we're working hard.
Definitely. I do see you working very hard. Based on your background experience, what do you believe, or why do you believe you would be effective as a mayor for Hawaii County?
So what I bring to the table is pretty much outside of the box thinking. I think that's, status quo is it's not going to work anymore. Same old business. I'm the type of person that is very innovative. I look outside of the box, try to figure out ways to service our community as best as possible. If you asked me about 3-4 years ago, or even 2 years ago, where do you see yourself in 2 years or 3 years? Do you see yourself as the mayor of Hawai'i Island? No. But I always had a heart for people. You know, my family in Kalapana always had the heart for people, on taking care of people in anything that we did. You know, I learned a lot of our community organization in the mid '80s with the eruption coming through Kalapana. I've seen how families came together to succeed during an eruption. Brought that to the 2018 eruption. And you know what we need? We need somebody that is real, that really loves people, that really cares about the people of Hawaii Island and how we strive to succeed, especially during a disaster. We need somebody to bring people together, uh, the right people together, and have a common goal to help our people, not only our kupuna and our keiki, but everyone to be successful. And I think I can bring that to the table, and that's what sets me apart from my opponent.
That is wonderful. Thank you. If elected mayor, how would you improve our community's response to COVID-19 to fill in the gaps from a medical and economic perspective?
You know, I think so. COVID-19 has it's a game changer. It's how we conduct business, conduct government, conduct business, conduct communication with people. Obviously, look at what we're doing now. Everyone's doing Zoom, so it's a lot more easier, a lot more effective. You can be at one place. You can be at multiple places at one time. Right at home, you can be in meetings in Kona, vice versa. So communication is one of the key successful platforms that we can use for us to move forward. Uh, but COVID-19, some of the plans that we came up with is based around communication, but also based around coming up with data science and common sense. Because you can, if you know more the common sense, you cannot express the data and the science. So, basically, what we've been doing in the last 7 months has been communicating with the community, communicating with different agencies, communicating with our county government, communicating our state government, communicating with a few federal personnel, and come up with the collective idea of how we can service our community the best way possible. And communication is pretty much the key for us. That's what we've been seeing now because of COVID-19 has, put a barricade in front of what we usually do. So that's something that I would bring to the table.
Thank you. With regard to improving healthcare overall in our community, what are your top 3 initiatives?
Healthcare. So, we talked about healthcare with one of our state representatives because that is their kuleana. But, one of the healthcare needs that we need now is to take care of our kupuna. Our kupuna during COVID-19 has played a big role of what's happening on Hawaii Island, and it's our kupunas that are being affected by it. So increase the healthcare and the availability for healthcare for our kupuna because they're the ones that are vulnerable during this time. We got to provide the best services to keep our kupuna safe. Another healthcare is for the immunocompromised, the health compromised patients. We've been getting so much calls and emails from mothers and parents and family members. Hey, we gotta make sure that our county governments maintain or keep my son, my daughter, because my son and my daughter has cancer. We gotta make sure that they keep the policies to keep our people safe during this time. So, as a county government, we've been trying to work with our state representatives to come up with great ideas for our health care system and how we can protect our kupuna. and our keiki and everyone in between. And telehealth, that's a big one too now. But in Puna where I live, the service here, service providers is so hard. If you go down to Ikaika, there is no service, there is no phone service. But we have a lot of kupuna that still live in Ikaika and that needs the services, but they cannot get out. They cannot leave because they could be susceptible to the virus. So they're afraid, but they don't have service. So we got to look at how we can build the infrastructure of telehealth within our communities, especially the rural districts, and figure out how the ways that we can service our kupuna in those areas.
Thank you so much for sharing all about that. Yes, I know telehealth is a really big one, so thank you for sharing on that. Thank you again for taking time out of your busy day. Lonnie, is there any questions that you had for Ikaika at this time? Or?
No, I just wanted to thank you so much, Ikaika, for sharing your mana'o with us this morning. We really appreciate it. And of course, your musical renderings was really a special treat for all of us too this morning. So I know that you have to run off to another conference. In fact, I can't believe how intense your schedule has been.
Oh my
on
God.
all of the different debate panels and everything you've been on. It must be such a whirlwind.
As you can tell, my energy is kind of down because we was going hard yesterday because of until late last night, studying for all these different debates that is coming up. So I gotta thank my team. Team behind me. If it wasn't for my team, I don't think we'll be at this, in this time and moment. I wouldn't be here. But my team's been working hard. We've been going. One point we're in Kona in the morning, Hilo in the afternoon, Kau in the evening, back to Puna. So it's like my car is racking up some miles. No, but thank you so much. We hold that to our heart. My family holds that to our heart of how hospice helped us taking over the role of bringing our grandfather back home. That was a special moment. And, grandfather, after he passed, he stayed there for a while for family and friends to come, and hospice stayed with us the whole time until he was gone. So, that was like to mahalo la hospice ohana.
Thank you so much, and best of luck, brother, on your campaign and your journey going ahead. We're really, really grateful that you were able to join us this morning, and we wish you the best of everything going forward. Aloha. Thank you again for joining us.
Take care. Aloha.
Aloha.
Aloha. All right, we will now like to turn the virtual microphone over to Lonnie Weigert, Community Relations Manager for Hawaii Care Choices, to discuss your healthcare choices. Aloha, Lonnie.
Aloha, Tish. Tish, thank you so much for allowing us to get to this part in the program. But before I go on, I'd like to know if we could go ahead and introduce Dan, because I'd love to take Dan along with me on my presentation today and kind of weave in all of the different questions submitted for him. If Dan is available, can you go ahead and introduce him and ask him his first question, and we'll start from there.
Sure. Aloha, Dan. Hi. Thank you for joining us. I want to let everyone know we have Dan Brinkman, RN and MPA. Mr. Brinkman first joined Hilo Medical Center in 2007 as the Chief Nurse Executive and was named Regional Chief Operating Officer in early 2014. Prior to moving to Hilo, he was the Assistant Administrator of the Interventional Cardiology and Cardiac Surgery at Vanderbilt University Medical Center. Mr. Brinkman's earned a master's in public administration from the University of Colorado and an associate's degree in nursing from Pikes Peak Community College in Colorado. and he also earned a Bachelor's of Arts in Political Science from Augusta State College in Georgia. He currently resides on the Hamakua Coast with his wife, 6 daughters, and extended family. Aloha, Dan. Thank you so much for joining us.
Aloha. Appreciate the introduction.
You are welcome. Can you tell us, Dan, what does HHSC stand for? And is it run by the state or a private entity?
Well, I answered that, but I would want to say that that photo that you have of me, I don't look that young anymore, but it's a nice photo, so thanks. I have an older one, but anyway, I was like, wow, that's been a while, but anyhow. But back to your question, what does HHSC stand for? It's Hawaii Health Systems Corporation. To get legalistic, it's a quasi-public entity owned by the state of Hawaii. And the reason it's quasi is that it has a lot of, it's been set up in a way that it can run more like a business or a hospital corporation rather than a department of the state. So there are still restrictions or structure around it that makes it different than a private facility, but it has a lot more flexibility. And probably most significantly, it's managed by a board of directors. The regions all have independent local directors that basically make decisions, decide how the money's spent, has a lot of control over the operations. And that obviously is different from, say, the Department of Health and Human Services, which is, a traditional state facility. So it's been arranged that way since 2007. I think it was 2000. No, actually since 1997. And then around 2007, they gave more control to, the local communities, which has been really important for East Hawaii and really for the Big Island, because West Hawaii is set up the same way.
Wonderful. It's good to know what that stands for now. Can you please tell us what clinics, long-term care facilities, and hospitals that are under that HHSC umbrella?
So, well, I just probably to answer the question, in a maybe a little more comprehensive way. HHSC has right now 4 regions. So they have the Kauai region. They have 2 facilities there, the Oahu region, which has 2 facilities, West Hawaii, which has Kona Community Hospital and Kohala Hospital, and then there's the East Hawaii region, which has Hilo Medical Center, Halehola Hamakua Ka'u Hospital, and the Yukio Kutsu States Veterans Home as part of its family. And then we also have kind of broken or kind of reorganized our services. We have a medical group, East Hawaii Medical Group, that's its own entity. And then we also have East Hawaii Health Clinics, which are a part of really our region. They're organized under Ka'u Hospital, but they really have all our outpatient services in that arrangement. So probably a little more than most people would want to know, but that is how we're set up.
That is definitely a lot that is covered under that umbrella. Thank you for sharing that. Lani, we'll take it over to you about Hawaii Care Choice's 3 main programs.
Thank you so much, Tish. Mahalo, Dan. Most people probably had no idea about all the clinics and everything else that comes under that umbrella. We really are so grateful that you're able to spend this time with us, because obviously with the umbrella covering so much, you're such a busy guy. So I want to really get you back to the farm out in Hamakua as soon as we can. So coming back to the different programs that we offer at Hawaii Care Choices, basically we used to be called Hospice of Hilo, but that was really insufficient when it came to the different programs that we started to branch off to. So we have palliative care now, which is a pre-hospice program. Hospice care is still at the center of everything that we do. And then bereavement care, where we provide additional care to families after their loved one has passed. Now, what is palliative care? For the most part, people don't even know what the word palliative means. So to palliate means to ease, to alleviate, to soothe, to relieve. And so what happens is this very specialized type of care has a very big umbrella, and it was created really to focus on symptoms that would occur when people had serious illnesses and they were taking treatments for them. And so these symptoms would need to have palliative care. And so basically, those that are dealing with serious life-limiting illnesses such as cancer, CHF, COPD, or kidney failure would definitely benefit from palliative care. It really is about quality of life, boosting quality of life for those who are dealing with serious illness and who are also receiving treatments. Palliative care comes in and really helps both the patient and the family. Oh, looks like it's time for a brain teaser, Tish.
Tish, I think you're muted.
Oh my goodness. Thank you so much, Keith. Sorry again, just to let everyone know, the polling question is: the goal of palliative care is to improve the quality of life for the patient and their families. True or false? I know we have a lot of people joining us on Facebook Live. Just wanted to let you all know you will not be able to engage in the polls. If you want to join in the fully engaged Zoom presentation next month, please email me at lfukushima@hawaiicarechoices.org. All right, so with that, we will share our results. 100% of our attendees said true. The goal of palliative care is to improve the quality of life for our patients and their families. Thanks everyone for joining in. Back to you, Lonnie.
Thank you so much, Tish. Yes, that's exactly the reason for palliative care. It's to boost the quality of life. So what happens is people will say, well, when do I need palliative care? Oftentimes, many of the doctors will say to call us when you get your initial diagnosis. And largely, it's to make you comfortable with what palliative care is and all the things that will be entailed with it. So people say, well, how do I know? And I'll tell them, well, if you're going to the emergency room several times or your loved one is going, and when I say several times in a month, that would be pretty excessive. Also, difficulty in managing the medications. Like there's all of a sudden so many medications. And when I say so many, I'm talking, over 20 different types of medications that you or your loved one is taking. And a real obvious one is diminished activities of daily living, where it's difficult to manage finances, driving, going to the grocery store and not really knowing what you're doing there, and having a really hard time preparing meals. Even light housework like throwing in a load of laundry or vacuuming becomes really a chore. And some of the physical signs too are just dealing with pain, fatigue, swelling in the feet and legs, and nausea as well. So when should palliative care begin? Well, like I said, at diagnosis is helpful, but if not, sometimes we'll get people who go to their doctor's office and then the doctor will make the recommendation, or maybe they go out to the hospital as well. But throughout the course of the illness, people can be on palliative care, which is good, because what happens is sometimes those who don't need us as much, may every now and then check in with us. But then there's others that may need a closer examination of their care, and we're with them more frequently. So we could be with somebody for months, if not years, depending on what their symptoms are. And so those dealing with serious medical issues could live longer really by signing up early, because we can help manage the symptoms where there isn't just this chronic pain and fatigue or just the discomfort. We're able to go ahead and help people. And again, for the bottom line is to boost that quality of life. So what would someone expect if they signed up for palliative care? A nurse would visit their home. actually, we have our provider that would come to the home and then do a evaluation on them. We would take a look at the person's health and medical history. What is so important about palliative care is it's really approaching the holistic approach of the entire being. So it's not only what are your symptoms, we want to know what other things might be ailing you. And we really approach it from 5 different types of pain that people are dealing with. Obviously, physical pain is one that's quite obvious, but then there could be financial pain where people are afraid because they can't pay for their medical care, or maybe they're concerned if something happens to them, what will happen to my family. There's also spiritual pain too, where people are feeling hurt on things that may have happened to them in the past, or at that time where I wish my adult children would stop arguing over the land, or I wish I said, I love you, Dad, before he passed. Just different things that people are dealing with. And then there is the pain of isolation, where nobody comes to visit anymore. Once they found out that, you know, somebody was seriously ill, they don't know what to say, and they feel uncomfortable, so nobody comes to visit. And that is a pain as well. And then, of course, just the spiritual pain of not knowing, why is this happening to me? You know, I've always gone to church, all of these other things, different types of pains that we will approach when we come and do our assessment. We always want to know what's the most important thing to the patient, because really, once we set the goals that the patient wants in front of them, we remind them about that goal as often as possible, because that's the reason people will fight and try harder in trying to get better. So as part of our palliative care program, we will also do medication review. And the reason we show this picture where this couple has all of these medications is it is a balancing act. It really is. And it's largely because when somebody is on palliative care, they may see their primary care doctor, but then maybe they have some kind of incident. And so they're whisked off to the emergency room, and then they get medication there. Well, maybe, you know, a week goes by and they head on over to urgent care, or maybe it's time to see their cardiologist or whatever ologist there is, and they're getting medication from everybody. Sadly, right now where the system is, nobody is telling anybody else what medications are being assigned to this patient. And so it ends up being lots of jars of medication. When our team comes in to help a patient with palliative care, we will do a medication review. And at that time, we will go over the different medications that is there at the home. Somebody could be taking as much as 35 different medications during that one day, where we can come in, we would do an inventory of the medications. We would call the primary care physician, who is the lead on our team, and go over the medications. And then maybe that physician will say, well, no, they only need to be taking this and that. And, you know, they end up taking 15 medications. I know that still sounds like a lot, but it's so much better than more than 30. So that is one of the things that we do in palliative care. So another thing is we will go there and we will help with symptom management as well. So, you know, people will have different symptoms depending on what they're being challenged with, whatever disease they're being challenged with at the time. So we'll come in there and we'll really do symptom management. For example, say they're complaining about the pain that they are dealing with. We will help work with their physician to figure out what kind of pain medication and at what degree they need to really make a difference so that they're comfortable. We find that when people are dealing with chronic pain, it's so easy for them to become depressed. And that's why it's important for us to get right on that as soon as possible. Care coordination is another really big part of our program, because we find that a lot of our patients are seeing well more than 2 or 3 doctors. And sometimes it's really difficult to get out there and see them all. So That's one of them. We want everybody to have an advanced health directive, so our social worker will go in there and take care of that. In fact, all of the patients that we have now on our palliative care programs all have advanced healthcare directives, which we're so very proud of. And we can also help with additional spiritual care if we find that that's something that one of our patients may need. Understand that palliative care is a pre-hospice program, and many people are still living quite busy lives during this time. So we have people, when there wasn't a pandemic, they were traveling to Vegas and doing a lot of other things. They were keeping very, very active. And so this is just to get to know that people that are going on palliative care, they are not just homebound. They're still living quite an active life. So how does palliative care get paid for? So for the most part, if anyone has Medicare, it would be a portion of that would cover. Or if they had Medicaid, some people have both. And in that case, all of it is covered. So for those who have other insurance, like HMSA, et cetera, normally there could be a copay depending on what the mix is. And so the copay would be very similar to a doctor's visit, which could be anywhere from $15 to $40 whenever a provider comes to visit. For us, our providers are the doctors that come to visit or our licensed social workers. So we do have several providers that will come there. And so right now, I wanted to ask Tish, is there any other questions that are coming in for Dan?
Yes, I do have a question for Dan. How are COVID cases being handled at the hospital and long-term care facilities under HHSC?
So it's, they're handled differently depending on depending on the patient and the location. So if a patient has COVID and they come in through our emergency room and they get admitted, depending on their level of severity, if they're really sick, they go to our ICU, which has a COVID pod. And then or if they're less sick, which the majority of our COVID patients are, they go to our med-surg COVID pod, which is, you need to be admitted, but you're not in need of critical care. The COVID pod can actually handle up to 23 patients. The most we've had in that unit, I think, is 18. At our height, we had around 20 COVID patients, and today I think we're down to 6 or 7. They're walled off from the rest of the unit. There's separate entrances for exchanging PPE. The protective clothing that's worn is a lot more extensive, obviously, than what you would find on the regular unit. In some cases, we put devices in to create what they call negative pressure, so the air is pulled out of the facility versus allowed to circulate. In the ICU, same types of precautions and arrangements, and we even have where, we have people who will help exchange and pass things through the pod to the regular area. So certainly a very different environment. It's a challenging environment for patients that are in the acute area because people are in like these bunny suits, taking care of you. It's isolating. We try to minimize interactions just to when the patient needs them to reduce risk of transmission, but that's very challenging for patients. But that's how we do it in the acute setting. In the long-term care setting, it's a little different because that's where people live. That's their homes. And so their rooms are their house with all their things that make home special. And so it is a different setting. We do have, though, different zones set up where we try to put patients together that are COVID-free or patients that we know have COVID. We keep them in a much more secure and protected area with a lot more PPE. We often try to dedicate staff just to that area. And then we often will have, well, we don't often, we do have a area where we quarantine people who may have COVID or people who are newly to the facility. We keep them there until we're sure that they're COVID-free, so we don't risk spreading that into the general population. So a lot of precautions there. Nursing homes are such high-risk environments that in most cases we've limited, there's no visitation. There's some movement in some of the rules that come from Medicare, Medicaid to restart visitation, but it's in a very structured manner. Because obviously with the dangers that are inherent with getting COVID in a population where people are elderly and very elderly and often have other health conditions, the risks are so high, that means the precautions are also very stringent.
Thank you so much, Dan. I myself feel well assured that you guys have covered all your bases, and it's definitely good to hear that there are not many patients in the COVID pod today. So thank you for that.
That's good.
Back to you, Lonnie.
Thank you, Tish. Thank you, Dan. That information will be kept up on our Facebook page so that people can tune in later to find out about what precautions you folks are taking up there. And I'm so glad that people will feel safe. It definitely, hearing it from you, we really couldn't go higher than that. So we're really glad that you were able to come and share that with us. So let me get back to the presentation on what is hospice care. So first of all, I wanted people to understand that hospice, just happens to occur during a time that people are entering their end of life. But really, hospice was created to ease terminal suffering. So death was never a requirement. And that's why it's unfortunate when people think that, oh no, don't call hospice because hospice equals death. It's really a misunderstanding for sure. We come in to make sure that people are not suffering in their last or final days. And it just so happens that oftentimes that is surrounding what we're doing when we're helping a family. So hospice philosophy is about treating the person versus the disease. So it's all about the quality of life, not the quantity. And so when we come in there, it's really about families spending time with their loved one. It's really about doing things that bring joy to the person, the patient. And so, we are hospice is under the palliative care umbrella. So it's a subset of what palliative care is, but it's very specialized because the philosophy of hospice really focuses on comfort. I remember when my dad wanted, he gave us his final wish was just like Ikaika's grandpa, he wanted to pass at home. And sadly, when he had an episode, because he had congestive heart failure, he was whisked off to the hospital. And by the time we got there, he had already passed. So it was very, very sad for our family that we were unable to deliver his final wish. However, when my mom got lung cancer years later, her doctor brought it up to us and said, hey, your mom can get hospice care at home. And we were, what is hospice care? We had no idea because nobody ever brought it up to us when my dad was sick. So anyway, we talked about it. My mom was a very staunch, pure Hawaiian woman, and she wasn't, we knew, gonna have it when we go and tell her about hospice. So anyway, I was tasked with that, and I went to see her and I said, Mom, guess what? You can have hospice care now. And she's like, hospice? Oh, I don't need hospice. Oh no, I'm gonna live a long time. I don't need that. So I told her, I said, okay, so you're not about hospice. So, all right, well, I heard that we can get free stuff. She's like, free stuff? Like what? And then I explained to her that included as part of her Medicare benefit, all of the different equipment that we might need for her at home, all of those things would be covered. And so I just switched the whole emphasis from a medical issue to a financial issue. And then she was all about it because my brother was already renting a wheelchair for her, etc. And so she said, well, you go ahead and you go check, I'm sure that it's not all included. It sounds too good to be true, and it's probably a gimmick. So I told her, all right, well, if I call and I find out and it is true, then what? She goes, well, I mean, let's save money. Go ahead and tell them to bring it in. So I did. And sure enough, it was true. And hospice had an entire team that came to visit my mom on a regular basis. She had the hospital bed, the oxygen, all of these wonderful things. And she could not believe it. And then she said, after months of care that she received, which, by the way, she lived well past the 6 months that the doctor had given her, and she was challenged with lung cancer at that time. She told me, I'm so sad that Daddy didn't get any of this wonderful care. So I want you to go out and tell all the neighbors in the neighborhood about this beautiful care that I'm getting, because I know that they're not going to know anything about it. So I said, well, I think that's a good idea, Mom, but I feel it's a little awkward, to go around and ask people or tell them about this beautiful service when there's nothing relevant for me to go up to them about this. So she goes, well, I understand. Okay, that makes sense. You figure out how you can go around and tell everybody about this beautiful service, because I know that they would appreciate knowing these wonderful benefits are already included. They don't have to pay for it. And many of them will see their last days without even knowing about it. And so 10 years later, here I am with Hawaii Care Choices, making sure that everyone in our community learns about hospice, whether you are on Hawaii Island or not. Hospice can take care of you wherever you are on whatever island. So it's from my mom to me. That is my promise to her. And so I really hope to get all of this information out there to all of you. So people will say, so what exactly is hospice care? Well, hospice care will come in and take care of those who normally have a 6-month life expectancy, and they are normally dealing with some type of terminal illness. Hospice will come in with an entire team, normally a physician, a certified nurse's aide, a social worker, trained volunteers, spiritual counselor, and then of course the registered nurse as well. And so they don't all come over at one time, just to let you know, but they do come over in a frequency to make sure that a patient or loved one remains comfortable throughout the entire time. And what is so important to know is that hospice will come in and really bring that boost of quality of life to the patient, but will also surround and really give a warm hug to all of the family as well. And so hospice is really there to help the family build their resilience on, getting ready for the imminent passing of their loved one, and really finding ways to deal with that, even while their loved one is alive. And so hospice is not only for the patient, it is for the entire family as well. So who qualifies for hospice care? Basically, anyone that's dealing with a terminal illness. The doctor will make the best guesstimate of 6 months to live, and normally the doctor will send that certification to us. And then for patients who are no longer seeking curative treatments such as chemotherapy, radiation, or dialysis, or going through any kind of surgery, normally those people are looking to qualify for hospice care. And so now what we're going to do is we are going to do another brain teaser.
Okay, everyone, the next brain teaser is up on the screen. The question is, hospice is where you go in your last days, true or false? Again, I just want to reiterate for all of those watching on Facebook Live, you will not be able to engage in the polls. If you would like to join our fully engaged Zoom, please RSVP to my email address at lfukushima@hawaiicarechoices.org. All right, so we have just a few more coming in today. Thank you all for just going in and plugging your answers on there. I'm going to give a few more seconds for those of you that haven't entered your vote in just yet. Okay, I am going to go ahead and close that polling there. I'm going to share the results. Hospice is where you go in your last days. 33% of everyone said it was true, and 67% said it was false. Thank you all for joining in. Lonnie, back to you.
Thank you so much, Tish. So I wanted to address for those who said that, yes, it is where you go on your last days. So it's very important to know that whenever hospice comes in, the earlier we can come in, the better. And the reason that is because not only will we make your loved one comfortable, but we'll start to really work with you on how to take care of them, as well as how to better deal with what is coming ahead of you as well. And so for those who refer their loved one to us, maybe in their final days, they will not have the wonderful benefit of that. And so it's very, very important to call us as soon as possible. And we find that a lot of times people may not call us because they think, oh no, I should be taking care of my dad. I'm supposed to be doing that. And then they feel guilty if they call us. I want you to know that in the family, everybody has a role that they play. And sometimes your role is to play the role of the daughter and let us, the experts, come in and take care of your loved one. Because not only will we know so much more with regard to all of the different ways and things that we will be taking care of for your loved one, but it allows you to really focus on the quality of time that you spend with your loved one and really can focus on all of those things that, you know, maybe you didn't have a chance to discuss with your loved one in the past. And now you have all that quality of time. So when is it time for hospice care? Well, similar to palliative care, you know, you notice that your loved one seems to be going to see the doctor more or is visiting the emergency room several times in a single month, tends to be losing weight and is very off balance often and is falling down maybe in the hallway or maybe in the evening when they're going from their bed to the restroom. They don't seem to be that hungry or thirsty. They have a hard time getting out of bed or even out of a chair. Or maybe they tend to sleep all day or most of the time. And so these are very clear physical signs that something is going on. And also, you know, as people age, their skin starts to thin out. But when somebody is dealing with their end of life, oftentimes infections start to show up on their skin. And so they start to have open wounds when it's time for them to go to hospice. So how does hospice care work? Well, we have a team just like we do in palliative care. And basically, we will provide all of the medications that are connected to the prognosis that we got the patient from, and also all of the medical equipment, just like I said, that they brought over to my mom's house. And then, you know, we always keep the primary care physician as part of the team. So a whole team comes to visit. So what to expect when you sign up for hospice care? So there's a care plan that's created for your loved one and the patient. Everything is patient-centered. So it's all about focusing on the comfort of the patient. And again, it's a very holistic approach, but it's very, very important. So we will ask for what are the what are the wishes or goals of the patient. And sometimes the patient will say, you know, I just want to be able to see my oldest granddaughter have her next birthday, or whatever their personal goal is. And we really keep that goal front and center for them. Or it may be something such as, I would just like to breathe easily in the evening when I go to sleep. You know, like, these are actual goals that people have, and it's so important for us to keep that front and center for everyone, so that they feel inspired to try for it, whatever that may be. And I tell you, you know, when I look at hospice care and I look at the program, I liken it to a level of service. So for me, in trying to explain the Cadillac of all services, which is hospice, I tell myself, let's just imagine that we are all on a flight to heaven. So our destination is already determined for us. Some will go out at 2 o'clock, some will go out at 4, some will go out at 8 p.m. But make no mistake, we're all going to go out on this flight at some point. So for those who are registered and signed up for hospice care, they will go onto the plane and go directly to the first class cabin. And the reason that they will go there is because that is where all the comfort resides. And it won't only be for them. Their entire family will go with them as well. So for those who didn't sign up for hospice for whatever reason, you know, they were scared or they didn't know about it, etc., they sadly do not even go into the coach part of the plane. They go directly to the baggage compartment of that plane. And the reason they go there is that is where the roughest, hardest, coldest ride is, all the way to the bridge of heaven. And all of the family goes in there as well. And what is so very sad is, although the loved one does make the trip into heaven, the rest of the family must take that very brutal flight back. And oftentimes, because they have no hospice support, they just shatter into a million pieces at the loss of their loved one, and do not have the benefit of 13 months of bereavement care to follow that up. So that's why I tell you, you know, when you want the Cadillac of services, definitely sign up for hospice care, because it's already included. You've already paid for it through Medicare. Oh, it's time for Brain Teaser.
All right, everyone, the brain teaser is up on your screen. The question is, my culture expects me to take care of my family with healthcare needs at home. Strongly agree, agree, neutral, disagree, or strongly disagree. Again, just to reiterate, those watching on Facebook Live will not be able to engage in the polls, but if you would like to join us on Zoom next month, at 10 o'clock, please RSVP to El Fukushima at hawaiicarechoices.org. Right, we have a few more votes coming in. Thank you again to all of our Zoom participants who are giving us their answers. Okay, we're going to go ahead and end the polling there. I'm going to go and share the results. So my culture expects me to take care of my family with healthcare needs at home. 17% agree, 17% are neutral, 33% disagree, and another 33% strongly disagree. All right, back to you, Lani.
Okay, Tish, I just wanted to double check. Did we get any additional questions coming in, either from the audience or maybe an audience question for Dan too? We can go ahead and take 2 of those at this time.
Okay, yes, they have been flooding in. Dan, question from one of our attendees is, my mom needs to have elective surgery. Is that being scheduled now in spite of COVID cases at the hospital?
Yes, we've actually been doing elective surgery since, I think we restarted them in middle of April. Initially when COVID happened, a lot of elective surgeries were canceled, mostly because they didn't want to use up personal protective equipment because it was in short supply, but that's alleviated. And probably the other reason, it wasn't easy to test people who would come in for surgery and find out if they had COVID. Both of those things have gotten better. So you can pretty much get any elective surgery that you need now. And I don't anticipate that changing anytime soon.
Thank you. Another question that we have is, with the talk of telemedicine during COVID, is there any plans to train seniors to use the system of telemedicine?
So in our primary care practices, our neurology practice, we actually have an initiative to sign people up for our electronic portal, which allows them to use an app and do a telehealth visit with their physician. We also have a telehealth coach that will help seniors and others sign up and work through their connectivity issues and how to get their phone to work or their pad to work or their PC with their camera, and get over that particular barrier. Admittedly, it just doesn't work for some because of their familiarity perhaps with electronic equipment. As I think Ikaika mentioned, in a lot of areas on the island, internet service or the cell service is poor. So the experience isn't that great. But that said, we've had a number which now prefer that interaction because it's such a challenge to have to come to the hospital, come to the clinic if you have mobility impairment or you don't have a lot of reliable transportation and you have to get your grandkid to take you or any of a number of reasons. If you can have a good telehealth interaction, especially for maintenance visits for chronic diseases, is ideal. So we're trying to get more and more seniors, really everyone that's interested, signed up. We think that's the wave of the future. But I also will say, unless our infrastructure on this island improves substantially, it will only be for certain folks. I don't see it being a replacement for in-person visits because the connectivity is unreliable, and in some cases, people need to actually do a face-to-face with their healthcare provider.
All right, thank you so much, Dan, for answering those questions. There are no more questions at this time, so Lonnie, we'll go back to you.
Thank you, Tid. Thank you so much, Dan, to answer that, because you're absolutely right with regard to the Wi-Fi broadband infrastructure. It's still lacking so heavily on this island, and hopefully we'll be able to improve that as time goes on. Thank you again for providing that information. So I'd like to move on with regard to our inpatient care center that we have, Pohai Malama Care Center. Many people don't even realize that we have this, but yes, it's on Kapi'olani Street in the middle of town, and people are confused as to why they need to go here. I'd like to share that this is not a long-term care facility. People come here to take care of symptoms that are unable to be controlled at home. So there may be those that are on hospice care at home and they have symptoms that they can't manage there, so they'll come here. The average amount of stay at this center here is normally about 14 days. People will either get better and go home, back to their families, or the majority of the people that come here will pass here at this beautiful care center. It has 12 beautifully appointed suites, and when people come here, it is definitely a home away from home, and in some cases it's even better than home. So people who come here will be under hospice care, and that is covered under Medicare. But for those who stay here in this center, room and board is not covered under Medicare. So many people will have Medicaid cover it, or an additional insurance that will pay for the room and board, or they can certainly pay out of pocket if they wish. So how is hospice care paid for? Well, the beautiful, beautiful news on that is, for most people who have hospice care at home, which I'd say is 98% of the people that we service, everything is included. All of it is covered under Medicare, just like I told my mom. It absolutely is true. So all of these different insurances here that are listed are all participating in the benefit for hospice, and so it would be covered. And the other wonderful thing about our team that goes to visit people at their homes when they have hospice care is we have these incredible trained volunteers. And these volunteers are specifically sent to a home to really give a break and a rest to whoever the caregiver is. We will always get people that say to us, "Oh no, you don't have to. I can take care of my husband myself." But then once they realize, because we really do strongly encourage them to take the 2 or 3 hours that we're going to give them that week to go ahead and rest, go and do their errands, go and clean the yard, or do, work in the garden, whatever brings them, this respite that they could definitely use and definitely deserve. And these wonderful volunteers will come to visit. We find that a lot of patients become so close and connected with their volunteers because it's a time where people will come, they'll, watch TV together, they'll play board games together, they'll play music together, or some volunteers will even take their patients down to the beach so that they can just see the water, or take them for short car rides, or some, they just want to go to Walmart. So whatever the situation is, these volunteers are very, very special and make the family feel very supportive, and also make the patient feel very, very cared for. So in addition to our palliative care, our hospice care, and now finally our bereavement care program, what is important to know is for those who we care under our hospice umbrella, we will automatically provide 13 months of bereavement care to that family after the loved one has passed. But we also have community bereavement for those who maybe lose a loved one unexpectedly, maybe through a car accident or a possible suicide, something really unexpected. We do have free group support every Tuesday at 10:30, and it is provided over Zoom so everyone can remain very safe in their homes. It's extremely convenient, and of course it is free, because a lot of times people will say, it's time for you to move on. I don't know why you're still acting like this. Grief has no time clock to it, and however we're able to provide different ways that people can learn how to deal with bereavement, then it's important for us to share that with them. So we also have children's bereavement as well. And in fact, we're going to have a virtual teen camp coming up later this month. So we are doing everything virtual right now to ensure that everyone stays safe. So our mission with Hawai'i Care Choices is to improve the lives of those we touch by offering support, guidance, and compassionate care of body, mind, and spirit. It really is about a holistic approach to every patient and family that we have the honor and privilege of serving. Our service area is from Lapahoihoi to South Point, Ka'u. And we have 2 other hospices on this island in North Hawaii and in Kona as well, to help all of those in those parts of the island. So the way to contact us is right here. You would simply call us, and because we are Hawaii Care Choices now, and really in sharing with you about our name, Hawaii is where we provide the service. Care is at the center of everything that we do, and Choices is our gift to all of you, that you have the choice of any of these programs to determine what is right for you. And sometimes your doctors will recommend which program might be best for you, but know that you can call us directly. We probably have a very large population that just call us directly. And so we encourage you to do that. Even if you're not sure, that's fine. You can go ahead and do that. And so before I move on to my next slide, I just want to check with you, Tish, if we have any more questions.
Hi, Lonnie. Yes, we have a few questions for Dan. Dan, what is your predictions on how long this virus will be active?
I wish I really knew, but you just said prediction, right? So I think the virus will be around a very, very, very long time. However, how long it affects us is maybe a different question, because if we have a vaccine, and it's a big and, enough people take it, then I guess the prevalence of the virus should drop dramatically, and so people would hopefully rarely get ill with it. I think it's a long way for it to be eradicated, but to have it where it doesn't impact our daily lives, I'm hopeful that happens here over the next year. Even if a vaccine, this is you asking my opinion, so I could be completely wrong here, but I think that from what I've read and followed, that several actual vaccines that are likely to get approval around the first of the year. And then there's the process of distributing them and deciding who gets them and convincing people that they're safe, and et cetera, et cetera. So I have a feeling we'll be dealing with this through the end of next year, but hopefully as the year goes along, it will be less and less of an issue. So we'll see.
Yeah.
Thank you so much for that prediction, Dan. Back to you, Lonnie.
Okay, Tish,
Oh,
I guess
that's
it's
me.
time for our final exit survey.
It is. All right. So, everyone, this concludes our presentation on the main choices, the main programs of Hawaii Care Choices. Thank you for attending today's Healthcare Talk story. A very special mahalo to our guests, Dan Brinkman and Ikaika Marzo, for their valued time and helpful perspectives that was shared today at our talk story. For us joining on Zoom, I am going to pull up a quick 8-question survey that will pop up on your screen. That should be up there now. We would love to get your feedback on our presentation today. Your input will allow us to gain a better understanding of how we can better serve our community with presentations like these. If you feel that you've benefited from this presentation, please let your friends and family know that they are welcome to join us on the 10th of every month at 10 a.m. Just RSVP to myself for the Zoom link, and my address should be up on the next slide here, but it is lfukushima@hawaiicarechoices.org. Dan, I do have a couple of questions that are actually coming in. If you don't mind, I ask them.
Fine, I'm glad to.
How does the virus affect your visitor policy for relatives of the infected person?
That one does have an impact on the visitors, and it's kind of wish I had a better answer, because it really limits how much family members can interact with that patient. So if the patient's is COVID positive in the pod, obviously having family members visit them who may or may not have been exposed to the virus, they would have to wear PPE. It would increase exposure and create many issues. So we don't allow visitation. We have a mechanism, just several ways for families to remotely communicate, FaceTime, Skype. We have people who will help facilitate that. The nurses will hold if the devices and help the patients if they can't communicate themselves. But bluntly, it's a poor substitute. It is. It's just one of the ugly parts of this disease and pandemic is that the people who get it have to go through it largely alone. And then there's no other way to sugarcoat that. It's just unfortunate. So it is an impact.
I see. Well, thank you, Dan, for answering that for us. Another question is, we understand the management of Yukio Veterans Home has shifted from Avalon to HHSC. What kind of changes at Yukio can we expect to happen because of this change?
So a couple of things, the changeover in management of the facility, this daily operations from Avalon to the East Hawaii region, has been agreed to, but that won't happen until January 1. So Avalon will continue operating the facility, as we go through this transition through the end of the year. It's a pretty big facility, so there are a lot of pieces and parts to doing this transition officially. So after first of the year, we'll be responsible. Part of our plan certainly is to, for ourselves, ensure that, the home is safe. Safe has become much more complicated these days with COVID, and it's a challenge for every nursing home. So certainly Avalon has had its struggles there. And we are always nervous in our other facilities as well, but we want to make sure our policies and processes are in place, and we feel as best we can comfortable that the facility's safe. The next thing, of course, and we'll be doing these things, concurrently, but we need to reestablish trust from the community to the home. The home, obviously, tragedies occurred, and it makes people in the community, nervous about would their loved ones be safe. That concern actually applies to all nursing homes. That's been something that the industry has struggled with since COVID has started. People are very nervous about placing their loved ones in residential homes. But it is a service that's important for our community, and the veterans who come there often, they are to a point where they can't get the care they need in the home setting. So we need to make sure that the community, the island, regains confidence in the facility, and so we plan to slowly, increase the census and get it full again. It ran full for years, and so we know there is a need and a demand. But that's the short version of our plan to improve the home and to hopefully get past this really tough time.
Thank you, Dan, for answering that question for all of us and giving us a little bit more information on that. I do have one more question, but before I ask it, I just want to let everyone know that is taking the polls. There are 8 questions. So if you could complete all 8 questions, and then the submit button will be blue and work for you. So Dan, our last question that we have at the moment is, does your staff work with the contract tracers to get information to determine where the patient got the virus?
To an extent, but most of that responsibility is carried by the Department of Health. So if a patient comes to our emergency room, they think they may have COVID, or they tell us they do, and we test and we confirm that, we care for their needs and make sure that we hopefully get them better. As far as where they got COVID and how that happened, in general, we don't get too much into that. We do monitor and watch for hot spots, because at times we've had several individuals get admitted that were from the same cluster, but we share some of that information that we have a patient here that's positive, all positive results get reported to the Department of Health, and our infection control person will discuss, if we're seeing trends. But in general, we don't take on the responsibility of contact tracing for our patients. We do a large bit of that for our employees. If our employees test positive because they work in a hospital setting and there's a potential to contract, COVID in theory, because we have COVID patients from the hospital, we take a much bigger role with our employees, but not so much with our patients. We just collaborate with Department of Health.
Thank you so much, Dan, for that. Lonnie, I think, was there a comment or a question that you had for Dan?
Yes, I have several. Thank you so much, Tish. Dan, I wanted to ask, we noticed that there's been a recent outbreak out on the Kona side. How is the hospital there set up to handle the spike that they're experiencing right now?
I think you're referring to the University of Nations, cluster.
Yes.
And I know enough of Kona Community Hospital and their administrator there that they have a lot of the same or similar precautions and planning for, taking care of COVID patients. We're 7-8 months into this, and a lot of the processes have been standardized as to how you care for them in hospitals. And I'm, quite confident that Kona Community Hospital has that ability. One thing to note, though, the University of Nations is mostly students, right? And there are some faculty, but it's a much, much younger population of COVID positive, people who've contracted the infection. And so in general, most of them avoid hospitalization, and they don't have a lot of the negative, outcomes that require them to go to a hospital. It's much more concerning when it gets widespread in a community and it crosses then all the age demographics and people with illnesses. That's when the hospitals start seeing a lot more patients. So while any outbreak's not a good thing, I probably would prefer it in the university or in the school setting with young people than widespread in the community. The biggest concern, though, is those individuals can take it home to their loved ones and spread it, and then in that case, then it takes a lot longer, but that could end up in the hospital setting. So I think Kona's got it covered. I wouldn't be too apprehensive at this point.
So thank you so much for that information. We notice now things seem to have stabilized over at Yukio. Do you have any idea how they were able to just manage that so everything sort of stopped?
Well, I think the virus ran its course. It infected probably about 75-80% of the population. So I'd like to say it was controlled. It really didn't. It got to the point that just about everyone did get infected that were residents there. And then the virus ran its course as far as the infection and illness and recovery stage. They haven't had any more positives here for the last several weeks, which is a good thing. I wish I could say it was contained, but it really wasn't. People ask, we see it in other nursing homes, why is this so impactful? Why did they have so many people die, bluntly? The population in the veterans home is an even more susceptible population than just a regular nursing home. Men are much more likely, significantly more likely to have a tougher time and to even pass away. And a veterans home, because of the time period, if you go back 70, 80 years, or when people were in the military, it was almost all men. So our veterans home is like 90% men. And so that makes it tougher. and their age, they tend to be a little bit older. 10 of the individuals who passed were in their 90s, 8 were in their 80s, 7 were in their 70s. So very, significantly older. So it's a much more at-risk population. We're hopeful in other nursing homes on the island that have had these outbreaks that, because of a difference in their population, that we'll see less mortality. So I'm hopeful, we're hopeful.
So, on the gender specific, so is it that men would not ask for the help, or why was that such a big difference?
They're not sure. If you read, some of the literature, one of the risk factors is being male. Males tend to, die a little more. Actually, it's that whole, maybe some truth there that women are stronger in the long run. But yes, being male is puts you in a little bit of a higher risk category. So.
Wow. Well, Dan, thank you so much for sharing so much information and just being completely open with us. We really appreciate it, because this information will have a ripple effect, meaning people will continue to come and listen to these different sessions that we're doing right now. And you provided so much information with regard to the areas that you oversee. And we really wanted people to feel safe, that it's okay to go up to the hospital. I mean, we do it all the time, and you folks are fantastic up there. So I really do appreciate that. And I just wanted to ask you, as we're just about ready to sign out, is there anything that you would like to add with regard to sharing any information out in the community at large?
Well, one, thank you for having me. And I so believe in the mission of, Hawaii Care Choices, and have had my own recent experiences in our family with them. And it's a great thing you do. So I'm honored to be here. As far as, any further comments, I think COVID will be with us here for a while longer. And as we, reopen to tourism and we go to the holidays, we're going to have to deal with people getting, getting COVID. We need, though, to make sure that we keep it manageable, that we, get back to work and do business, which is, I think, so important for our economy, but that we're also really smart with our mask and our social distancing, and we don't do stupid stuff. But I think you can also, be confident that the hospital can care for those cases, because there will be cases. And as we get our spikes and we go up and down, we're, I think, able to handle it and take care of our community's healthcare needs and manage this COVID until we get to a vaccine. So I'm just going to reassure folks out there that we're ready and we're there for you.
Awesome, Dan. Thank you. Thank you again. It was such both a privilege and honor to have you. And I mean, just to have this kind of access where we can come and ask you directly, we feel extremely humbled. Thank you again, Dan.
You're welcome, Lonnie. Thank you.
And Tish?
Thank you to everyone, Dan and Lonnie, for speaking today. Thank you for all of those who attended and all of those who watched on our Facebook Live. I hope you all have a wonderful Saturday, and we'll see you next month, the 10th at 10 a.m. Aloha.
Aloha.
Aloha.